When it comes to coping with cardiac events in their distributed community, the cardiovascular telemedicine infrastructure in the Balearic Islands helps patients get the best possible care wherever they are treated. There are 11 ambulances in the Balearic Islands, each equipped with an MRX. All these ambulances can transmit electrocardiograms for archiving in the ECG management system. Then there is one hospital in Manacor, which also uses Philips electrocardiographs and also archives the electrocardiograms in the ECG management system. And then there are some primary care centres that transmit their electrocardiograms. When a primary care centre has filed its electrocardiograms in the ECG management system, they can consult with the doctor on duty in the referral hospital to find out if they need to transfer their patient. There are also non-urgent cases, when they might ask the cardiologist in the referral hospital to check on a particular patient in the ECG management system to determine whether this patient needs to undergo further tests at the hospital. For example, it costs €17,000 to transfer a patient from Ibiza to Mallorca by helicopter, and it may turn out that this transfer was not necessary. The most obvious changes have been in emergency services. The people in our service are delighted because it is a fundamental improvement. Because you treat the patient, you do the ECG, you send it, and then speak with the cardiologist immediately. 4 eyes are better than 2. You make the decision to treat the patient and the cardiologist says, "Look, bring them in because we'll have to open the artery." But this is done in real time. When the system started, it was evident that it was very quick and very simple. The program lets you view the ECG of the patient with very good clarity. Treating a patient, monitoring them and saving the ECG with the Philips software was a dramatic change. And it is very fast. It takes 30 seconds. It does not interfere with the medical treatment of the patient. And as regards the patient's prognosis, it has meant a massive improvement. It is much better to transmit an electrocardiogram because that way you can bypass the emergency room. Because all the doctors involved in treating the patient already know the patient is on the way. That way you gain 30 minutes before reperfusion, which is the main advantage. The change has accompanied the introduction of an extensive data collection system. The Myocardial Infarction Registry began in 2008. It records all the cases of infarction with a high ST that occur in the Balearic Islands. Of these, there is a percentage who are attended by non-hospital emergency medical services. 40% were attended by this service, and for most of these we were able to have the electrocardiograms before reperfusion treatment. This also has another use, which is to detect very early electrocardiographic changes that occur in ischemic heart disease in myocardial infarction, which sometimes go unnoticed by some doctors. The infrastructure to support telemedicine for cardiac care has become policy for local government. The ECG management system is an electrocardiography filing system that has many benefits. It can serve as the archive for an entire autonomous region for all the hospitals, with all their primary care medicine digitized forever. The results have enhanced prognoses and increased reperfusion rates for the inhabitants of and visitors to the Balearic Islands. We have managed to reperfuse about 83% of all patients. Previously, this figure was around 50%. Now it is 83%. We have quantified the prognosis, the time taken to reach the patient, the time taken for the hemodynamicist to get to the table, the time taken for the nurse to get to the catheterization table. These times have been shortened with the real-time transmission of ECGs. This is a big improvement for the patient, and I think it's a breakthrough.
Y esto ha mejorado mucho al paciente.